You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's called full mouth reconstruction or extreme smile makeover. We've had them on the program before talking about dental implants, but today we're talking about full mouth reconstruction. Maybe you're not quite ready for a full mouth of extractions, but you need a combination of procedures to give you the smile you've always wanted. Everything we talk about today, he teaches this to dentists across the country. With us, we have Dr. Daniel Briskie. Dr. Briskie, welcome to the program.
Randy, thanks for having me. I'm very excited to share how impactful and powerful a smile can be.
Okay, good, good. I kind of accused you of exaggerating in the green room. I said, well, it is just teeth. It was like fighting words, right? It's more than that. Good for you. Now, you brought some photos, and I'm not trying to side with you, but they look good. I mean, these are dramatic photos.
They look great.
And it's true. I mean, is it true, I should ask, that everything we're talking about, pretty much you teach? You have a training center in Colorado.
Yes, correct. Yeah, we do. So I've been training dentists now for over 2 years. I've trained about over 200 dentists now on the procedures of, using a combination of procedures to promote a smile makeover. By teaching all these dentists, the best part is once they go home, guess what happens?
What?
All the patients that I now see can eat, laugh, chew, smile again, and it's a big impact on their lives.
Now, I said at the top of the show that your teeth and gums are never too bad to have the smile you've always wanted. Is that really the case?
Randy, great question, because there's honestly hasn't been one patient that I've seen in my clinic that I haven't been able to treat through some sort of combinations of procedures.
Do they all think it's like they're the worst? I think you told me that.
Sometimes they'll say that. Everyone is the hardest on themselves. We're always the toughest on ourselves, right? Something to ourselves is always the biggest deal.
Okay, now, give us a working definition of what full mouth reconstruction, I know that's a dental, I guess that's what you guys call it. Give us a working definition of what that means.
So a full mouth reconstruction is also called like a smile makeover, right?
Okay.
This can be a combination of procedures that I do. This is the same things that I teach. It can be implants, crowns, veneers, fillings, root canals. I also do root canals, which is great. Most dentists who do the type of implant procedures or cosmetic procedures don't do root canals as well.
Okay.
Bridges, it can be even though nowadays we don't really do as many bridges because implants have replaced it. And even just whole replacement of teeth. So really anything A to Z.
Okay, good.
Yeah.
So your typical patient, they come in and what? They don't know their options.
The biggest thing is most people just don't know what their options are. And the hesitation comes from the fact that if you don't know what the option is, you're going to be hesitant towards figuring it out.
Okay, and nobody likes a dentist. Do you ever hear that?
We hear it all the time.
What do they say? How do they say it?
They actually, most people will just kind of blatantly sit up and they'll say, just to let you know, I don't like the dentist.
What do you say to that?
I say, well, I'm going to change that for you.
Okay,
I'm sorry that you had all that mistrust before, but the new day and age, dentists are not like what they used to be in the past.
Is your secret goal like to win them over?
Like
where they want to go to the dentist?
I always win them over. That's the best part. It's like a challenge, right? You just have someone that says, I don't like the dentist. It's like, well, I'm going to change you.
Okay, good.
Yep.
That's good. That's good. Now, so you brought some photos, and these are people that had these extreme smile makeovers, these full mouth rehabs.
Correct.
So what are we looking at?
So in this stack of photos, I picked my favorite 10, and I know in the past, in the green room there, you told me to throw out a bunch of them. You said there's too many of them. So it was really hard for me to kind of pick these 10. So I picked these 10 out of my favorite, probably the past 300 cases that I've done.
And it's like I said in the green room, I said, it's just teeth, and then after looking at some of the photos, it is pretty dramatic how it changes your facial, attractiveness, I should say.
Yep, 100%. Okay. Yep. So this first one, please take a look at her. This is just a before, and I'm smiling because the fun part is knowing that you don't know where these cases go, right? Okay. You just wait for the surprises to happen. So in this first photo, you can see that chip there, right? And you can see the dark spaces in the back. She couldn't eat well. She couldn't smile well. When you're looking at that smile, yes, it is an okay smile, right? But she's not happy with it at all. And you can just tell by the facial muscles that she's not really smiling. She has this relaxed smile because she's ashamed of her smile.
Okay. Yeah. So what do you do for her?
What we did for her was I did a combination of procedures, and I'll hand you this photo.
That looks good.
We did a combination procedures of implants, crowns, veneers, all the above. And now when you look at this photo, you can tell that the teeth actually follow the natural shape of the lower lip. It looks amazing. They have bigger teeth, they fit her better. This is actually a selfie that she took in the chair because she was so happy with it.
Oh, really?
Yeah.
Now, are these people like they get their new smile, now they're doing selfies on Facebook?
Yes, oh yeah, yep, you know, what, Instagram, TikTok, whatever the kids do now these days, right? Yeah. But wouldn't you say that she looks younger in that one?
Yes.
Yeah. Wouldn't you say that her muscles are actually, elevated there? She has been so many years of not smiling to the full potential that now she's smiling all the way.
Okay.
Yeah. And the coolest part is her smile will get bigger after this.
What do you mean by that?
A lot of the patients actually say that their face starts to hurt after we give them teeth.
Interesting, because they're not used to smiling.
100% they're not used to smiling. They say, Doc, my face hurts because I'm so tired of smiling all the time. So it's a new muscle that they're going to start training to not get so tired again. Look at the after photo real quick.
Okay.
Zoom in, look at the teeth. Now, when you're looking at the before and after, specifically the after, how did we get there? Right? Like this isn't something that just happens overnight.
Because they appear to like perfectly fit her.
Exactly.
Okay.
And this is how it originally appeared the next day, right?
Okay.
So a lot of people in different clinics, they can't get results like this.
You say your technology makes it happen.
The technology is the key. We use the technology, specifically a CT, a facial scanner. Now the facial scanner actually takes a 3D image of the entire face, puts it on a computer where you can rotate it side to side. And you can actually mesh that picture with your CT, and you can actually see where the teeth are, the smile is for the patient. And then what you do is we have a designer that works on a computer and then will artificially put the teeth that look perfect, a perfect Hollywood smile, onto that camera. And that's actually what we use to get that perfect result.
Looks good. Now, what's it like when they look at their mirror for the first time?
There's always mixed reactions. I say we have some people that look at it and they'll say, all right, they'll look at it like, is that really me, right? With smile makeovers, it makes you look more educated, more sophisticated. And pretty much every person that we have for before after photos, if you look at the after photo, look at how she and pretty much all patients are looking right at the camera now. Right? It's the self-confidence. It's the little things.
You say when it's all done, like they come back for their cleanings or follow-up, they're almost unrecognizable.
Yep.
What do you mean by that?
So a majority of people will come in and just even the way that they greet our staff differently, like, hey, how are you, right? Or looking at you right in the eyes.
Okay.
And wanting to make more conversation. That's the fun part.
Nice,
Yeah.
nice. Does she have more photos?
Yep, yeah. So this next one, here's this one.
Okay.
She's actually a nurse. Cool story about her. She actually saved her husband's life with CPR recently. This is only a few months ago. Very, very fantastic lady. She deserves a new smile makeover. So before, when you're looking at this picture, it's not a bad smile, right? I mean, there's some teeth there, but you can tell that she's not really smiling to the full potential. She's not happy. To get this photo, to get her to smile, sometimes I'll actually have to tell the patient, hey, if you don't smile for me, I'm going to have to tickle you, right?
Okay.
You say something like that to actually get them to smile. Because for the majority of them, they just don't want to smile or actually show you what they have. This patient specifically, she's been everywhere, okay? She's actually been to Mexico numerous times to get some dental work done. She came back to me frantically telling me how she can't eat now, she can't chew. People with bad teeth, they can't eat the foods that they want, right? Okay. Apples, corn on the cob, beef jerky. One of the most popular ones that I hear before and after are, I can have yogurt, but I can't even have granola.
Okay, okay. So salads are out of the question.
Salads are out of the question.
Nuts or
all the
almonds or
crunchy
whatever.
vegetables. And after we do a complete smile makeover, one of the best foods that people will start eating are actually just vegetables, the crunchy vegetables.
Okay.
Yeah.
Let's take a look at the after.
Yep. So here is the after. This one was actually recently. And
Very nice.
would you believe me if I was to tell you that those are just temporaries?
Yeah, looks nice.
They look amazing. Yeah. So the final teeth will actually look even better than that, even stronger, which is great. So now look at her. She's smiling with her eyes, right? You can see how there's no more dark spaces in the corners of the lip. The teeth are bigger. The shape is better. She's all around way happier with her smile.
What do they say to you when it's all done, like somebody like this?
So people like this, for the most part, on the day that we give them those teeth, which is usually the same day, most are actually a little bit speechless. What I found is I'll usually have to give them a few days to actually process what has changed in their life. And then they actually will tell me, usually at their first visit, how much their life has changed, how much they can smile, what they'll start going out to eat again, right? They'll actually start socializing more, which is the best part when we get a little bit older, is actually it's actually the foods that we eat and the people in our company, right? And the people that we should sit down for a meal with. And for the most part, people that are ashamed with their smile or can't eat, can't talk, they avoid all of those things altogether.
You say people, that come to you usually have hated their teeth for like 10 years. 10 years plus.
Yeah. 10 years or more.
Okay.
Right? It's
They put
very
it off
common.
because you think the fear of the dentist, fear of the pain, the fear of the expense, all
It's
the above.
not only the fear portion as well, it's that they don't have an option. They may have gone to see their dentist, their local dentist down the street, and they just didn't know what to do.
Okay.
Right? And it's not their fault that they didn't know what to do for this case, but now these patients are stuck, right, where they don't know what to do, and they, for the most part, they just don't know what their options.
Is this one of those things where they say, I should have done this years ago?
Yeah, what they usually say is, I wish I would have found you earlier.
Okay.
Yeah.
Okay.
Yeah.
Very nice. Very nice. Now you wanted to be a dentist since like high school.
Yeah.
In fact, you worked in a dental office since you were a little kid.
I did.
Your
My
dad's a
dad's
dentist.
office, correct. Yep. My dad is a pediatric dentist. So
Okay.
I think that's kind of where I've gotten some of my principles of being very empathetic towards my patients.
Now, is this true? I'm going to throw. These are some of the things you've said in the past, that the most expensive part about these full mouth makeovers is going out to eat all the time.
So this is expensive. It's worth every penny. But you know what the most expensive part is?
What?
It's actually the big bills you get at restaurants.
Okay, so you're going out to eat all the time.
Yep. So you're no longer eating the softer foods from the shelves in the grocery store, right? You're going to all the local restaurants that you're going to start to try out now. And maybe you shouldn't get the lobster or the prime rib, right? It is the most expensive thing.
And we
on the
see
menu.
those hair commercials where the guy gets his hair back and he's running and hiking and fishing. It's kind of like the same with teeth.
Yeah, 100%. Yes.
Like if you don't like something about yourself, it holds you back. In a
It
way.
does, and you have the power to change it. You do.
And this is, to you, is this like a quick fix? Like, do you think if more people knew, I know it's technically demanding for you,
Yeah.
but if more people knew how easy this could be, as far as time, there's not even enough dentists to handle these type of things.
No. So here's some good statistics for you. So it's averaged that 95% of people with the smile makeover, right, who don't get it in the specific time period will end up in the denture, like a dental wheelchair, I like to call it, because it's a crutch. There's over 22 million people that need this procedure done in the United States, and we're estimating that only 30,000 of them get taken care of every year. So we are failing at actually tackling this disease as a whole.
Okay.
So when you said that it takes, that it could take a long time or it could be a difficult procedure, I actually have the complete opposite thought process of that. When I look at a smile, even like this last one for the before, I start smiling because I know I can get that done in one day, right?
Is that
That's
right?
actually very easy for me to do.
But
they don't know that.
So you have to fit, like, what if they have gum infection? I mean, does that slow down the process dramatically, or you just clean it up quickly?
It does not slow down the process at all, because the best part about coming to a dentist like me, where I can do a majority or almost all these procedures in-house, are we can do this under IV sedation or oral sedation, right?
Okay.
So they're sleeping. So for them, it doesn't matter because they're sleeping. We take care of everything in one shot, and you're not having all these painful visits that will take maybe 10 months somewhere else.
Okay, good for you. Next photo here.
Yep.
It's very good.
This is the next one. This guy, Alex, he is one of my favorite. His
wow.
personality, look how much he's smiling.
Okay.
He is just the happiest guy ever, right? But he came to me because when you're looking at this picture, look at all the missing spaces, right? There's missing spaces, multiple infections. He's in a lot of pain. He can't eat, he can't chew. He's actually a veteran as well. So just a really, really great guy. He actually made his own fake teeth for the front. And he actually
made his own teeth?
He made his own teeth. They would come in and out. And he's actually more of a graphic designer, I believe, at home. He actually did a very good job. We were almost thinking about hiring him to work in our lab.
Okay.
Yeah.
Okay.
So here is the after.
So this is one of these full mouth reconstructions.
Correct. This is a full mouth reconstruction. We did a combination of procedures, crowns,
Looks like a pretty cool guy right there.
Yeah, crowns, veneers, implants. Now look at the changes in his appearance. He's got a little swag to him when he comes into the office, right? He comes into the office. He is the happiest guy ever. He comes in, he high fives everyone. He'll always give me a hug every time he comes into the office. He's just ecstatic.
So what do they like more? The way it looks or what they could eat?
So, great question. Now, specifically with Alex, when he came in, his biggest complaints were that he couldn't eat, chew, right? He didn't know what to do. He was only eating specific, very soft foods. So when we gave him his new smile, now he can eat, chew, right? Any of the foods that he wants, again. But the thing that he wasn't expecting was just how amazing his teeth were going to look.
Like a guy like this looks in the mirror, what? He's just, well, I know that the sedations, they're a little probably under sedation, but are they just like, they don't even know how to react? Are there ever tears? He
had a ton of tears. He was actually, I think, probably one of the most grateful patients that I've ever had. And it's hard sometimes on myself. You see a grown man smiling, and you're going to want to also shed some tears there. And with this specific case, there was not a dry eye in the building when he got his teeth.
So again, I mean, he's a young guy. And so if you did nothing, he'd probably end up in a denture.
Correct. Majority of people, 95% of them, remember, do end up in a denture, unfortunately.
Okay.
Yep. And it's our goal to move them from what I'd like to call a denture, a physical disability, and with a smile makeover, you can give them a physical ability.
And you save teeth whenever possible,
yes,
right?
100%. That's the best part about my job and the education that I've had is we don't just do one procedure. There's majority of clinics out there, they do one thing, right? And that's remove all the teeth, right? So you go in, you get one option, maybe two if you're lucky, but it's still the same process. But at my clinic, because I also am a regular dentist as well, I do focus on saving teeth when I can.
Now for these full mouth reconstructions, you say people are financing it because even the best dental insurance covers only a small amount. Medicare, Medicaid doesn't really cover it. So is that right? Like more than half of the people on these major cases are financing?
90% of them are financing.
Oh, really?
So
and you take care of it for them?
We do.
Like you help get them qualified?
We do. So dental insurance is kind of like having a coupon now. Do you ever get a Bed Bath & Beyond coupon in the mail?
Yeah.
It's just like that. You use your coupon, and your coupon could be valued at $1,000 or $1,500, or a handful of times we see $2,000 coupon, right? But to use your coupon, you can only use your coupon once a year. So what are you going to wait 10 years to fix all of your teeth or fix one tooth a year? It doesn't work like that.
So financing.
Everyone nowadays is going to be financing it. We have up to 6 options now that a lot of other providers don't know because we teach it. So we know the kind of the secrets of how to get people financed for this. Let me show you this next patient.
All right.
This patient, look at the dark spaces in the mouth, right, and the corners. She's not happy with her smile at all. She's missing several teeth in the back, and through a combination of procedures, we fixed her smile. So a lot of people actually have bleeding gums, sore gums, multiple infections, right? So the first step is actually cleaning all of the infection up, the bleeding gums, right? And then we go there to start adding some teeth. So here, now look at this one.
Very nice.
Very nice, right? But do you notice in that picture that she is not smiling all the way?
Okay, a little bit. Yeah, you could tell.
Yeah, a lot of people are retraining themselves to smile again.
So she's just not used to smiling big.
Exactly.
Okay.
Yep. So over the next few weeks to months, she's going to start smiling, and that smile is going to get 2 to 3 times bigger than that.
So once she starts getting a few compliments, and then she's smiling all over town.
Yep. It's like my teeth do look good. Now I'm going to go do my hair. Right.
Okay.
Yeah. Check this next one out.
Oh boy.
This is one of my favorites.
This is graphic.
This guy had, some unforeseen circumstances in the hospital for a very long time, had multiple accidents, and wasn't even really allowed to brush his teeth for 3 years. So you have to remember, a lot of these times when people need a complete smile makeover, this is not their fault, right? Life may have been a little bit hard on them. Well, let's look at this photo, and you can tell multiple broken teeth.
So he didn't like to smile.
He didn't
did you
like
have
to
to kind of
smile.
ask him to do this, show his teeth?
he wouldn't show me his teeth originally. And when you're looking at this smile, it's a little bit of an awkward smile, right? It's a forced smile. And, they're protruding his bottom teeth forward to show me his bottom teeth at the same time because he's not used to smiling. He doesn't know how to smile. So multiple broken teeth here, bleeding gums, multiple infections. And what we had to do first is just clean him up. And then through a combination of procedures of veneers, crowns, implants, we did a complete smile makeover.
Now, when you see a guy like this, I want to ask you this. And if it's not true, just tell me. But do you ever think you're hearing their bad hard luck story and you get excited, you're going, this is going to be good.
I almost find myself like, if someone's telling me something negative, right? Or a sad story behind them, I actually will sometimes catch myself from smiling. I'll start smiling because what they don't know is that this is going to be one of the best transformations of their lives, and they just don't know it yet. Yeah.
Let's take a look at that after.
So check this one out.
Oh my goodness, doesn't look like the same guy.
No. What happens with the majority of these people are, look how sophisticated he looks now, right? He's got even glasses on to complement, accessorize a little bit. His beard is more trimmed. Even his beard is trimmed better. The teeth are straight. They fit his arch way better. There's no big spaces. We've replaced all the teeth in the back. I think a great transformation.
You say people with bad teeth are judged.
People with bad teeth are unfairly judged, right? Very, very unfairly. So let's say you're getting on a flight, right? And I'm going to say Southwest flight because you can pick wherever you want to seat, right? And you're the last one on because we're always the last one on the flight. And there's two spots open. There's one on the right side of the plane, one on the left side of the plane. Okay. On the right side, you have a woman that's smiling really big, but she's missing multiple teeth. The teeth are dark, right? Okay. On the left-hand side, you have a woman who's smiling very big, but has a Hollywood smile. Who would you sit next to?
Okay.
Right? But the unfair part is that a majority of people are going to sit next to that person with the pretty smile.
Like in the movies.
When they
want to make somebody look bad, homeless, they give them bad teeth.
But that's extremely unfair, right?
Yeah.
And what I've found is people who have had these smile makeovers afterwards are actually the people you need to be sitting on an airplane. They're more kind, right? They've been through some things before, that a really unfair treatment in the past. So the best part about having this impact is they change, and now they want to pass along that smile to other people.
So this guy's, in a way, your hunch, maybe I don't know if you know this or not, but do you think like this guy's whole trajectory, where he ends up is different?
Yes. Oh yeah, 100%.
Because of the smiling and the self-confidence and everything else that goes with it.
Yep. Randy, smiles are extremely important. I think most people underestimate it. I want to share this, this small story. It's actually a children's story. Okay. It's very easy to understand. And what the story is about is called The Smile That Went Around the World. And inside this book, there's a little boy who gave some cookies to the homeless person. After he gave the cookies to the homeless person, the guy driving next to him smiled because he saw how happy the child was to give something. Well, that guy went to the airport, got on a flight, went to Hong Kong, right? And then what happened later down the story is the little boy had a soccer game. He didn't do very good in a soccer game, and he was sad. Well, his coach is actually a pilot, and he actually just got back from Hong Kong. Okay. So the meaning of the story is that smile traveled from where the boy originally gave the person cookies all the way to Hong Kong, traveled back around and made him happy again. So nice. Just the importance of the smile, it's so understated. How important it is, because even just simply a smile has the profound impact to go around the entire world and help you out.
Very nice. Yeah. Now, young people do this, but what are the upper ages, like 80s, that are doing this, that are coming in? My
oldest was actually 89. I have a few friends that have done a little bit older than that, but that's my personal
Really?
oldest.
So they're getting older and older. People are living longer.
People live a long time now. Yep, thank God.
They want to look good. Yep. Okay, I'm going to rush you, because I know you have a stack of photos.
Randy, here's another photo of this guy. Very awesome guy. He actually he came to all of his appointments for cleanings and brushed his teeth like great, even though he knew that he needed a complete smile makeover.
Okay.
Yep. Pretty cool. So check out this after.
Very nice.
Right? Amazing. This is a selfie he sent us. You can just tell how big that smile is. Look how big those cheeks are. You can see those muscles have been exercising a little bit.
Changes his look.
Yeah, it changes his look. His eyes are very happy.
I can't help but see that guy from across the room over there.
Yo, check this next one out. This guy also has a very bold personality.
Jeez.
He is not ashamed at all, though. the things that he didn't like were that he couldn't eat the foods that he wanted.
Okay.
That was the biggest thing. He didn't care at all about the aesthetics of what it really looked like. But let me show you the after. Now he cares. He moved from wanting to eat the things that he wanted to eat to now his favorite part is actually his smile.
The way it looks.
The way it looks. Correct.
That's very nice.
Yeah. Randy, let me show you a couple more.
Okay.
Check out this before and after. Amazing, amazing smile.
And these are all full mouth reconstructions.
Full mouth reconstructions.
Extreme smile makeovers.
Yes.
Okay.
Correct. Yep. And that's one more photo of her. Just look how amazing her hair looks right now and how awesome her smile looks.
Teeth look
This
good.
next one is one of my favorites.
Oh, wow.
The before and afters, right? Look at the bleeding gums, the broken teeth, and afterwards she can smile, chew, eat, love, everything, anything that she wants now. So here's one more, Randy. This gentleman had braces for years and years and years, had nothing left to do. We did a complete smile makeover, and then check out the before and after. Look how white those teeth look.
It does look
fit
good.
His face nice.
It
looks
changes
amazing.
the look of this guy.
Yeah.
Right? He goes from just a regular guy, now looks like a CEO of some tech company.
Yeah, he looks sophisticated. Look how big his eyes are now, too.
Yeah,
right?
yeah.
He's looking with confidence at the camera.
Okay, okay.
And here's another one. Again, this guy, one of my favorites as well, was in this photo, you wouldn't know that he's shy. He looks like he's smiling, right? But one of the shyest people you'll ever meet. He would avoid going out to eat, socializing.
He tells you this on the console.
Yeah, he told me that at the console. Yep. And here's afterwards.
One afternoon.
Look at this guy, right? He should be wearing a shirt and tie and, working, higher up on Amazon now.
So with the technology, like your dad's a dentist.
Yep.
So you're just able to do things he couldn't do when he was your age.
Yep.
Like it just wasn't available.
Yeah, it wasn't. I actually have had invited my dad out a few times now to come check out the courses to see how extremely different now it is.
We're out of time. Final message to the person that's watched this. They got a lot of problems with their teeth and gums.
Yeah.
They've heard what you have to say, but they're still skeptical. What do you say?
Come to my practice. Sit down with me and let's talk about how I can change the course of your life with a brand new smile.
Okay.
Right? I want to get you to chew, eat, laugh, love, all of those good things again. And what my personal responsibility is, the legacy I'm trying to build, is to change that world one smile at a time.
Okay, good. I want to thank you for coming on the show. Do you see them on the console?
Yes.
Almost every time. Now,
Every
what's
time,
the best way
every
to
time.
make an appointment? Call your office or go to the website?
Both. I would recommend usually calling first because
Okay.
that's the best way for us to understand your needs.
Okay, good. I want to thank you for coming on the show. Good
Thank you,
stuff.
Randy.
Thanks, Dr. Briskie. You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.